Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, cardiological emergencies can occur at any time and anywhere. So if such kind of situation arises, what should be done in the initial stage? And one of the cardiological emergency is hypertension. So discuss on this topic, we have with us in studio today Dr. Debanga Borah, cardiologist from Excel Care Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, doctor, thanks so much for coming to our show.
Hello.
It's again a privilege to have you back in our show, and we'll be discussing again some of the cardiological emergency. So today we thought that we will be discussing on hypertension. Very common topic. That is high pressure, seen in every household these days. So we'll start with it, and what would you like to tell the viewers at first?
Thank you, Pooja. Thank you, the audience, to come forward to see this program. Today, apart from all other cardiological problem, I like to today discuss on hypertension, which is more common in our society, and which one is one of the most common diseases among us. But still it is ignored by many people as it is not such a big problem. So I have seen in my day-to-day practice that hypertension is something like they say it's okay, it's fine, it's not a problem. But what we have seen in the end of the scenario that it causes lots of problem to the human life.
They think that it's a very common problem, so taking just medicines would help it out.
Basically, they doesn't want to take medicines.
Okay.
They want to. It's good also sometimes, but whenever needed, so medicines should be added in the life to control the hypertension. So first of all, you should know what is hypertension, basic thing.
Yeah.
So people, they don't know. The hypertension is basically, in common people term, is called increased blood pressure or increased BP. So what is increased BP is the actually increase in the blood pressure in the arterial lines. And the normal value is, everybody confused with the value. The normal value is the if it is more than 140 systolic BP, the upper one, and if it is more than 90, the lower one, then it is, we call it at a hypertensive patients.
Okay. 140 upper and down is like 90.
Yeah. So still it's not, then what happened in between means sometimes people say 120 is also a upper limit. Actually what happened, the American Heart Association or some authorized centers, they stages the hypertensions.
Okay.
So
there is a stage wise in the other countries.
Stage wise, it is followed by the Indian also, Indian doctors also. So the stages are like these. Please remember, the stages are like these. If your BP is less 120 is systolic BP, your upper BP is 120 to 139. It's stage 1.
Stage 1.
It's pre-hypertensive. It's not, you are not hypertensive, but it is called as a pre-hypertensive. Or your diastolic BP, that your lower one, if it is 80 to 89.
80 to 89.
Not 90, 80 to 89, less than. So in between these people, you are called as a pre-hypertensive. That means you are going to be hypertensive patients. So it is called pre-hypertensive stage. Hypertensive stage 1, if it is your systolic BP is your 140 to 159, if upper one. Or diastolic is 90 to 90 to 110. So if it is better, more than these, more than 160, it is called stage 1, and if it is more than 160 in systolic, then it is called stage 3. Stage 3. Yes. So stage 3 is more dangerous, and we have to treat it vigorously and immediately. So these are the stages. So it's not that you are in the pre-hypertensive stage. Sometimes they say my BP is 138. But remember, it is more than 120 systolic BP. So you are pre-hypertensive. You have to take care of your body mentally.
And a proper checkup and a regular checkup is also very important, because we have seen in our households that if unless and until you are very ill or you are suffering from any kind of disease, then only you go for a checkup to the doctors, and then your BP is being checked, and then you get the figures, and then you become more nervous, isn't it, doctor? So at that point in time, when any of the person comes to you, they get a shock like after getting the numbers. So what advice do you give to them?
No, that's the main thing. How will you diagnose the, first of all, how will you diagnose? How will you know
let's talk about the symptoms.
Symptoms,
and
How will you know the, it's a hypertensive. Basically, the hypertensive patients, it's a silent killer. Basically, most of the people they doesn't have lots of problem or any problem whole the life, and or when they presented with some symptoms, it became so late that it is difficult for us to treat him. Like they sometimes come with a stroke with paralysis. They come with sometimes massive. This is called cardiac heart failure. Sometimes may present it with MI, myocardial infarction or heart attack. So hypertension may sometimes present it with that also. But basically, it is a silent killer. But sometimes they present with some symptoms like there may be dizziness, there may be some headache. Headache is one of the most of the common I have seen is the headache.
Yeah, most of the common and the basic ones.
And the basic one is the headache. Come with a headache and basically in the backside. They say pain in the neck, back of the neck. Basically dizziness. Then easy fatigue. Sometimes they say I feel tiredness while walking.
All right, doctor, we'll come to that symptoms and causes. We have the first caller of the day. Let's take the call and then we'll proceed with our conversation. Hello. Hello. Hello.
Thyroid thakile he hoy niki hypertension problem hoy niki
Okay.
Thyroid thakile hypertension problem নহয় হাৰনে একো হেতু ৰিস্ক ফেক্টৰ নহয় থাইৰয়ডৰ লগত কিন্তু এটা কথা হৰমোনাল থাইৰয়ডৰ এটো যেটো হৰমোনাল প্ৰবলেম হয় কিছুমান হৰমোনাল প্ৰবলেম থাইৰয়ডৰ লগত যে এসোসিয়েটেড হৈ থাকে তেতিয়া হলে হয়তো হাইপাৰটেনশন হ'ব পাৰে কুচিং সিনড্ৰোম এটা তাৰে ভিতৰত পৰে কোনছ ডিজিজ আছে তাৰে ভিতৰত পৰে তো আৰু বহুত ধৰণৰ এনেকুৱা থাইৰয়ডৰ প্ৰবলেম ফিঅকমাচাইট্ৰমা বুলি কওঁ আমি এনেকুৱা ধৰণৰ কিছুমান থাইৰয়ডৰ হৰমোনাল প্ৰবলেম আছে যিবোৰ হাইপাৰটেনশন ক্ৰিয়েট কৰিব পাৰে সো অকল থাইৰয়ডৰ প্ৰবলেম হলে হাইপাৰটেনশন সাধাৰণতে নহয় কিন্তু যদি থাইৰয়ডৰ প্ৰবলেম থাকে তেতিয়া লগত যদি হাইপাৰটেনশন থাকে তেনেহলে হাইপাৰটেনশন হয়তো এগ্ৰিভেট হ'ব পাৰে মানে আকৌ বাঢ়ি যোৱাৰ চান্স থাকে বা ই এডভাৰ্স এফেক্ট কিছুমান হ'ব পাৰে
All right. So thank you so much for calling, and I'm sure you must be benefited with what just doctor has mentioned, and you will take a good care of it. All right, doctor. Coming back to the symptoms and causes of hypertension. So
basically, apart from that, aru ami emergency department eta bostu dekha pao je hypertension emergency hisabe patient like etaman there is bleeding from the nose.
Bleeding from the
yes, it's also very common. It is called we call it as epistaxis. Suddenly, all over the patient is okay fine for last few days, but suddenly he said I am being bleeding from my mouth also, bleeding from my nose also.
Okay.
So this is called epistaxis, and this is basically
so does it happen in the extreme case or is it the basic symptom?
Extreme cases this is bursting of any artery. So bursting of artery from the nasal cavity or nasal artery is called epistaxis. It may take in the brain also. If bursting happen in the brain, it is called stroke. Bursting may happen in your main aorta. This is called aortic dissection or aortic aneurysm, where the bursting may happen. These are very dangerous. They may kill the patient in 1 to 2 seconds also.
Okay.
And if there is a artery burst in the main aorta, then we get very little time to save the patient. So, but interestingly, all the symptoms there may not be any symptoms.
So there are lots of basic symptoms that one has to take care of it. So what are the initial and the first or two symptoms? Like people will have to take good care of it, and they will have to take the parents or the other guardians also will have to take care of if they have seen such kind of symptoms. So do they have to immediately shift them to the hospital?
Yes, definitely. Basically, there are two emergencies. One is urgency and one is emergency in hypertension. And hypertension was detected basically is clinically.
All right, doctor, we have a caller, so let's take the call. Hello.
hello
আপোনাৰ প্ৰশ্নটো কৰিব
মই গুৱাহাটীৰ পৰা কৈছো আপোনাৰ চটো চাই আছো মই সুধিব বিচাৰিছো যে হাইপাৰটেনশনৰ যিখিনি বস্তু হয় সেইখিনি অকমান মেণ্টেল ষ্ট্ৰেছৰ কাৰণে হয় না অকল ফুড হেবিটৰ ওপৰত ডিপেণ্ড কৰে কাৰণ মোৰ মানে দেউতা 70 ইয়াৰ্ছ হৈছে 70 ইয়াৰ্ছ হৈ যোৱাৰ লগে লগে দেউতাই অকমান সময় কেতিয়াবা কিবা অলপ এলুফনেছত থাকি যায় কিবা চিন্তা কৰিছে মাৰ কপালৰ পৰা ঘাম ওলাই তাৰপিছত গাত কিছুমান বইলৰ নিচিনা ওলাইছে এতিয়া গৰমৰ দিনত এটো কি হাইপাৰটেনশনৰ কাৰণে হ'ব পাৰে নে ফুড হেবিটৰ কাৰণে হ'ব পাৰে নে বেলেগ কিবা এটা
মই এক্স্যাক্টলি তেওঁৰ বস্তুটো ধৰিব পৰা নাই তথাপিও হাইপাৰটেনশনৰ ফুড হেবিটৰ লগত ডেফিনেটলি ৰিলেচন আছে
He's online, you can just cross
মানে তেওঁৰ আপুনি ক'ব কি সুধিব বিচাৰে যে ফুড হেবিটৰ কাৰণে হাইপাৰটেনশ্যনটো হ'ব পাৰে নেকি বা ষ্ট্ৰেছৰ কাৰণে হ'ব পাৰে আচ্ছা ডেফিনেটলি আমাৰ যিটো হেৰি আছে হাইপাৰটেনশ্যনৰ ওপৰত যিখিনি ৰিস্ক ফেক্টৰ আমি গন্তি কৰিছোঁ তাৰ ভিতৰত আপোনাৰ লাইফষ্টাইল মডিফিকেশ্যনত ফুড হেবিটটো এটা ওৱান অফ দ্য মানে হেৰি ধৰা হৈছে মানে তাৰে ভিতৰত চ' ফুড হেবিটবিলাকৰ ভিতৰত সাধাৰণতে যিবোৰ ফেটি ফুড বা হেৰি ফুড থাকে যিবোৰ আপুনি জানেই সাধাৰণতে তাতে সল্টেড ফুডবিলাক যিবিলাক থাকে আচলতে হাইপাৰটেনশ্যনৰ ক্ষেত্ৰত পাৰ্টিকুলাৰলি হাইপাৰটেনশ্যনৰ ক্ষেত্ৰত সল্টটোক মানে খুব সাধাৰণতে মাহাত্য দিয়া হৈছে সল্ট ফ্ৰী ডায়েট বা সল্ট কমাই খোৱাকৈ যিটো কমন সল্ট হয় সেইটো কাৰণে সেইকাৰণে বজাৰত দেখিব কিবা বেলেগ ধৰণৰ ফৰ্মুলা ওলোৱা হৈছে সল্টৰ কাৰণে চ' সল্টটো কমাই খাব লাগে আৰু ফুডৰ ডেফিনেটলি আছে যদি হেভি সল্টেড আৰু লগতে ফেটি ডায়েট আপোনালোকে খুব খায় তেতিয়াহ'লে হয়তো হাইপাৰটেনশ্যনটো বাঢ়িব পাৰে তাৰ বাকী আপোনাৰ আৰু কি ক'ব ষ্ট্ৰেছৰ কথা সুধিছিল আপুনি এবাৰ ষ্ট্ৰেছটো ডেফিনেটলি হয় ষ্ট্ৰেছৰ কাৰণে আপোনাৰ কজ কিছুমান আছে আপোনাৰ মানে হাইপাৰটেনশ্যন কিহৰ কাৰণে হ'ব পাৰে বেচিকেলি এনভাইৰমেণ্টেল ফেক্টৰ বুলি কয় কিছুমান আমি সেই এনভাইৰমেণ্টেল ফেক্টৰবিলাকত ইয়াতে আপোনাৰ আমাৰ ফুড আছে আপোনাৰ এলকহল স্মকিং আৰু লগতে চেডেণ্টেৰী লাইফষ্টাইলটোক আমি এনভাইৰমেণ্টেল ফেক্টৰৰ ভিতৰত ধৰি থৈছিলোঁ চ' যদি সেই তিনিটা কাৰণৰ কাৰণে হয়তো আপোনাৰ প্ৰেছাৰটো বাঢ়িব পাৰে হয়তো হেৰি নহয় আৰু বাকী ৰিগাৰ্ডিং চুৱেটিং হোৱাটো য়েছ ডেফিনেটলি হাইপাৰটেনশ্যন হ'লে চুৱেটিং হয় এইটো এটা ওৱান অফ দ্য চিমটমছ আৰু বাকী আপোনাৰ বইলটো সাধাৰণতে হাইপাৰটেনশ্যনৰ কাৰণে নহয় তেওঁ ডায়েবেটিছটো এবাৰ চেক কৰি ল'ব গৰমৰ কাৰণে সাধাৰণতে বইল নহয় কিন্তু কিবা ইনফেকশ্যনৰ কাৰণে হৈছে হয়তো ডায়েবেটিছটো আছে নেকি তেওঁ বা যদি নাইও তেতিয়াহ'লে হয়তো আৰু বেলেগ কাৰণে হাইজিনটো চেক কৰিব লাগিব সেইটো কাৰণে হয়তো তেওঁৰ বইল হ'ব পাৰে গাত কিন্তু আপুনি যিহেতু কৈছে ষ্ট্ৰেছ আৰু খাদ্য আমাৰ যিটো হয় সেইটো ডেফিনেটলি আপোনাৰ হাইপাৰটেনশ্যনটোৰ লগত ৰিলেটেড আৰু আপুনি সেইটো চাব লাগিব ডেছ ডায়েট বুলি কয় যিটো আপোনাৰ আছে আমাৰ D2 ডায়েট কওঁ মানে এটা আমেৰিকান ছ'চাইটিয়ে আমাৰ এটা ডেছ ডায়েট বুলি কৈছে যে ডায়েট ইজ টু ৰিডিউচ দ্য হাইপাৰটেনশ্যন যিটো ডেছ তাতে বেচিকেলি ডে চেইড ল' চল্ট 2300 মিলিগ্ৰাম সেনেকৈ তেওঁলোকে দিছে পাৰ ডে আৰু লগতে টু ইনক্ৰিজ দ্য ফাইবাৰ যিমান যেনেকৈ আমাৰ দিছ ভেজিটেবলছ they said you have to increase the
So is this also applied in our country as well?
Yes, we have to apply our dietitians are they are following this diet protocol.
All right, so let's doctor coming back to the symptoms and causes. So initially when any of the patient comes to your hospital with any kind of symptoms, so what is the first thing you advise them or what is the first diagnosis is being done to the patient?
That's why I'm telling there is a two variety of emergency in the for hypertension. First of all, first emergency is called urgency and then the next one is emergency. If the patient is coming with a high BP, it's more than 140 and if there is no target organ damage means there is no target there is no organ damage means his liver is okay his brain is okay there is no his heart is okay his kidney is okay there is no epistaxis bleeding from any part of the body so we call it the urgency so within 24 hours we try to reduce down the BP with the oral tablets
Okay.
and first of all there is for these patients you have to there are two methods one method is lifestyle modifications and second is the medicines so first you understand that doctor will do the medicine part but first part is always yours this is lifetime modification what is the lifetime modification is the reduction of your weight
Okay.
first of all next as I said diet management
Reduction of weight is very important.
BMI
Proper
is
diet.
BMI should be around 25 something like that your BMI you have to calculate your BMI then this diet habit then do regular exercise how will you reduce some people they say nakhai pelao kisumane they never eat and they reduce no you have to do regular exercise what is the exercise as I said earlier that you have to do at least 45 minutes of exercise per day if you can do in 7 days it's okay per week or if not you take 1 day rest 6 days but do regular exercise and if you cannot do in even the regularly then you do whenever it's possible and next is cut off the smoking part and control diabetes and other metabolic disorders These are the lifestyle modifications,
And these are the lifestyle modifications, like anyone can adapt it and anyone can reduce it, because this is not that much difficult, isn't it?
This is basically whole part is from the patient side.
Yeah.
This is not basically from the doctor
because
side.
Because as doctors, you will advise medicines, as doctors, you will provide treatment, but the more the percentage is being also has to be provided by the patients, isn't it?
Next part is the doctor side. They will give medicines orally. Initially maybe injection, but orally we'll give medicines. We'll send the patients, we'll call him in 24 hours. We'll see blood pressure. If not, then we add another one. Okay, fine. What is our emergency? Emergency is that patient coming with high BP with some organ damage, like patient come with a high BP with stroke, patient come with a high BP with MI, heart attack, patient come with high BP with renal failure. So we'll admit this type of patients. We have to reduce down the BP in 1 hour. And for that we have to use IV injections, and it is only possible if we admit the patient in our hospitals.
All right. So this is being done. So how to reduce those pressure amounts and pressure figures? So what is the first thing you do, doctors, and what do you advise to the patients?
No, as I
and
say,
especially to the attendants as well.
I said already, in the hospital too, basically the doctors will do with the drugs only. There are lots of drugs, IV drugs are there. So they will deal with the drugs, like Anti-Z is there, Labetalol is there, beta blocker. There are lots of drugs are there. So the common people, they may not know the thing, but for the urgency where target organ is not damaged. So I say that same things that you just do the lifestyle modifications is very essential. And another thing is you have to take the regular drugs, regular medications. And you have to say for the attendant, you have to, because the hypertension is more common in the older people, they sometimes forget to take the medicines also. So attendant, it is the attendant's duty to ensure that he is taking the medicine
and
regularly.
We have also seen that if the pressure is normal, so they don't take their medicines on time, or they think that they shouldn't take the medicines.
One of the most common thing that whenever the patient become normal, they stop taking medicines. So this is very common. So I said don't stop medicines until your doctor say that you stop it. You can reduce the medicines. Sometimes what happen due to over enthusiasm or due to some problems with, or maybe because of some drugs, the pressures drop down very fast to that patient. So he may feel some dizziness or some symptoms he may feel for the medicine. Sometimes the patient may feel dry cough due to some medicine. Sometimes they feel dizziness, sometimes they feel breathlessness, something like that. So it's not that you have to stop the medicine. You immediately consult your doctor, and don't consult a doctor who is far apart. Like a patient of Tezpur should not consult the doctor of Guwahati for hypertension, because Tezpur locally there are lots of doctors. You consult with the local doctors that we should continue this thing or not. It is same with the diabetes also.
Only after the advice by the doctor,
if
you should stop or you should continue.
You stop, or you can reduce the dose. Basically, you can reduce the dose, or you can change the medicines further to other medicines.
All right. So, doctor, would I like to ask you that what is the normal blood pressure by age? Because nowadays we have seen that pressures and blood pressures is also seen in the younger generation as well. So, what do you have to say on
basically, what in the literature said the risk factor is more than 50 years. But nowadays in our country, we have seen there are lots of hypertensive patients in the young. So it is called happy hypertensive patient in young. It is new term. It can happen from 18 years to, it can happen not in the 18 years, in the young age, in the little child also you can have hypertensive patients. So it is common because of the same thing is your lifestyle. We are using lots of mechanical things like computers and mobiles, or physical activities are reduced. We have lots of stress in our life. So this causes our food habits is not good, or everywhere there is a fast food, hotels are there, and
so basically the food habits has to be
that's why they are causing the lots of problem in the human life, and hypertension is coming as a disease in young also, and you can surprise every 3 to 4 people. After every 3 to 4 people you ask anybody is a hypertensive patient. In young population, every 6 patients, after every 6 patients, 1 patient will get a hypertensive patient. So it's very common.
Okay, so has any these kind of patients or the young patients have come to your hospital and you had to make them understand that you should you should always take care of your lifestyle, which has changed a lot?
We will counsel them. It's in our scenario in Assam, it is very difficult because maximum they never understand what is hypertension actually. So we have to convince them actually what happened, what can happen in the hypertension. A hypertensive patient, what are the complications, basically we have to tell them. If it is a hypertensive man at young, means if he became hypertensive at 30 years, so please remember, if a patient is hypertensive at 50 years, so the organ will damage from 50 years than 70 years. So there are only 20 years. Or that organ that not much will damage. But if a patient is become 30 years and he become hypertensive, the hypertension will get enough time to damage the organ. And first, what are the organ will damage? First of all, I'll tell you. First, it's not that it damages brain also, it damages on the kidney also. First of all, in the brain, he can have stroke, he can have dementia. In the eye, he can have vision loss. In the heart, he can have heart attack and MI. In the kidney, he can have renal failure. And as I said, epistaxis is one of the bleeding from the nose. In the aorta, I said already, very dangerous and one of the most cardiac emergency worldwide, where we cannot save the patient if we never intervene in 1 to 5 minutes. It is aortic dissection and aortic aneurysm. The blasting of aortic dissection and aortic aneurysm. So they may be silent and it may present suddenly in the emergency department. So so young hypertensive should take their medicine regularly, and if you are hypertensive, please be aware or and do whatever necessary and control your lifestyle as much as possible. How much is possible.
All right, doctor, we'll come back again because we'll have to slip into a short break. So viewers will slip into a short break and do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on hypertension, and Dr. Debanga Borah from Excel Care Hospital is with us in the studio to discuss more. Let's move across to him. All right, doctor, we were talking on the symptoms, causes of hypertension, and we had a fruitful discussion. So let's proceed with the treatment. Like, how can we control hypertension?
First of all, how can you diagnose the hypertension is basically most important. So in our hospital, basically the patient come with some symptoms. With that symptoms, we'll proceed. And the diagnosis is always in clinical. We'll measure with the machine, mercury machine is there. We'll use sometimes digital machines also there. And whenever we found it is hypertensive, that is BP is more than 140, or systolic and diastolic is 90, then we immediately go for some investigation. Like we have to do for one ECG and there is one echo. So ECG is you show is there is any organ damage in the heart or not, and is there any problem in the an echo will do to see whether any thickness in the heart or not.
So that is the first diagnosis being done.
Apart from that, we have to go for some blood tests also. So that is the main investigation. Then whenever he is already diagnosed, he is a hypertensive, then as I said, we'll think of whether it is target organ damage is not. We have to ascertain whether there is any target organ damage. If there is a target organ damage, then we have to go admit the patients, or if it is not, then we'll have to reduce the BP with oral tablet and we can send the patient to home. So the diagnosis is, apart from this diagnosis, next thing is that what are the lifestyle he is now possessing. So that is again I am saying the lifestyle you have to change. If it is a young, you have to change your lifestyle, or if it is not, then if it is a old age, then we have to at least at the age of 90 years he cannot do regular exercise, something like that.
Absolutely.
But he have to cut down his diet and this thing. So these are we have to look after. So we have to think lots of things about the patient, and then we'll proceed accordingly with the.
Okay, so this was the diagnosis part, and this is how it is being done and how a body is being checked and how treatment starts. So when the treatment starts, what are the precautionary measures you advise to the patient to take care of, and to also to the attendant, and how things can be controlled?
No, and that's I already said that we have to control the BP by the medicines, and we ask the attendant to look after what is his they are taking actually. If the patient about the patient, if they are taking regularly the medicines, then it's okay. If they are not taking the medicine regularly, then we have to inform. So that is the main thing. And attendant have a vital role in these things. That they should take care of the patients, whether and they have to make the arrangement that patient can follow up with the doctors regularly.
All right. Now, we have seen that these days stress, lack of sleep has also become a major concern for everybody. So, is this also a part of hypertension? So, on this, what discussion can be done?
Yes, definitely. Basically, lack of sleep and this stress, as I said, it is very common in young ages now. So I already said in earlier that now our lifestyles are very, very stressful. We have lots of it's become very fast, our lifestyle. So everybody knows that they are all in stress. Though stress is one of the recognized as one of the major cause in now to cause the hypertension. That's why the government, what they do, they now giving Saturday and Sunday off. You have seen many private hospitals, many private companies, they to make stress relief. So and lack of sleep, it's another very dangerous. Many people they in night duty, and even after doing the night duty, they have to do the day duty also. And this is another kind of stress actually. So that also may cause hypertension. So
because that causes stress, and stress
sleep is important. One of the 6 hours of sleep is very important. Actually, what happened? Sleep is not important. Say how you sleep. Your sound sleep is very important. You can sleep 6 hours to 8 hours, but your sleep is not good. But people can sleep 2 to 3 hours. Their sleep is good. So there is some difference. You have to take a very good sound sleep actually. So if the sleep is not good, you can take the help of medicines also. Because ultimately sleep needed to the body, because during the sleep your body is regenerated. So that also may help not in the reducing the hypertension, but also in the another metabolic disorders also. So definitely, and one condition is called sleep apnea syndrome. During the sleep, you have to see lots of 80 people having snoring. During the snoring, there is a apnea. Apnea means there is a stopping of taking breath. So it is called apnea. So it is called during sleep there is apnea. So it is called sleep apnea syndrome, and it is one of the major cause of hypertension, which can produce stroke. And it happens so silently at night. So that the people say he is okay in the night time while sleeping, but in the morning he didn't get up and he had stroke actually. So this is one of the.
So we can see it's one of the silent killers. So stress and lack of sleep. So one should have a proper sleep hours, isn't it, doctor? So we have also seen that nowadays these generation or anyone where they surf a lot on internet and they take out things, they take out more informations. So do they also come with those informations to your hospitals that I have seen on internet that hypertension can be cured this way or that way? So lots of questions arise in their mind. So at that point in time, what is the thing or what is the first thing you advise to them? And a psychological study is also very important nowadays.
Psychological study is very important. We have a psychologist if they never understand, and people do come with the searching for different type of problem with the internet and they come to us. So internet is not always right sometimes. And the thing is, general internet problems, internet will give you a generalized problem, but the in problem to us is a individualized. Individual to individual, the problems are different. If I say it, a person is coming with a hypertension, with a stroke, his treatment is different. A person coming with a treatment with a heart failure, hypertension with a heart failure, the treatment is different.
Okay.
But the person who is coming with the hypertension with complication, the person internet will say is another problem. So they give you a rough data. But the doctor who is concerned is basically is the best person who tell you what the scenario and how to treat. So
All right, doctor, we have a phone call. So let's take the phone call, then we'll proceed with our conversation. Hello?
Yeah, hello. How sleep apnea is related to hypertension? I just want to know.
Okay.
Okay, so can you please repeat your question once again?
Hello.
Sleep
Hello.
apnea and hypertension.
Sleep apnea and hypertension. How is it related to each other?
No, I say it is sleep apnea is one of the cause of hypertension. It's basically the apnea part which is very dangerous, which cause physiological changes in our body, and along with that it causes the cardiac output that this will again aggravate the cardiac cycles, and then hypertension will happen. So it's a complex process. So you can just understand that sleep apnea can cause hypertension. Now one of the cause of hypertension which can lead to stroke. So not only stroke, it may cause to the heart failure also, the sleep apnea. So how to control it? Basically, sleep apnea is we basically found in the fatty obesity persons. So first of all, you have to reduce your weight. How much you can possible, do regular exercise, as I said, lifestyle modification, and next medically you will get some machines. They are called BiPAP machines or CPAP machines are there. If during the sleep time you have to apply this machine to the patients, and the machine take care of the sleep apnea. If the patients forget to take this breath, then machine will give you the breath, and the normal respiratory cycle will continue accordingly. So the only treatment, the other treatments are there, but you have to consult pulmonary medicine consultation before that. They will give you some medicines like bronchodilator and many things. So that will also help. And main idea of sleep apnea, curing of sleep apnea is to increase your lung capacity actually. So and dilate your bronchioles so that you can take the breath normally. And the sleep apnea basically happens because your neck became short and your tongue became very swollen, and during the sleep it fall down and it obstruct your airways. So that is the one of the cause. So the machine will that will also help to reduce your respiratory difficulties.
All right, and I'm sure the viewer who have just asked the question must be benefited with the answer. So doctor, we were talking on the psychological study and the psychological part of any of the patients, lots of questions in their mind. So how do you deal with those?
Psychological, this is basically psychiatrist part. We will not do this thing, but how much we can, we have to deal their psychology also. So what happened, whenever you come to me as a hypertensive patients like you
with lots
ask
of confusions in
lots
my
of
mind.
confusion whether I am hypertensive or not. But first of all, I have to convince you. So that is my part actually. If I can,
Okay.
I can convince you. If I cannot, I cannot. That's the main thing. But I have to counseling as my best way that you are a hypertensive patient. These are the problem you may happen. If I say no, you have to take this medicine, otherwise you have become your heart become weak and you will go to heart failure. So definitely you will run away to another doctor and you will not take the medicines. But that way you have to make him understand that you have to take this medicine. Then you have to follow this thing, and you have to follow up on this way.
And the final decision is on the patient.
And the final decision on the way. If still he is not convinced that I am not convinced with you, then I will send him to a psychologist. They take their part and they will consult with him. If otherwise, maximum they will understand that I am hypertensive and they will take medicines. But the most bad thing in our society is that whenever BP became low, or become normal after taking medicines, they stop medicines.
Yeah.
They're scared of
This is the
taking
common
medicines.
thing which
It's
we
a
see.
common thing I have seen that they're scared of taking medicines because of the side effects. But if the common term is there, if the medicine has a side effect, but they never never stop taking the fast food and this thing, even though have the more side effect than these medicines.
Okay.
So I request the viewers to as that if you are hypertensive, you would take medicine, because hypertensive is world third killer in the world. So you should take medicines regularly. It's not a it's not like I'm just talking. It's worldwide. It is happening everywhere, and they are discussing about hypertension. That please take the medicine, and so that you can control and use, because young generations is a asset to the nation. If something happened to him in the at 30 to 40 years, then it's very difficult. It's very for a society or for the other part that how can we live.
All right, so this is something like one has to take care of, and psychologists are there, so taking care of all those things. And we have seen that the hospitals provide a lot of like treatments, and nowadays equipments are so advanced. So what do you have to say on the equipments, doctor? So because like when people come with lots of questions in their mind, so they have to be given assurance that things will be more positive. So what positive notes do you give to the patients that advanced technologies are there, so nothing is to worry about?
Regarding hypertension, basically regarding hypertensions, what are the advanced technologies? There's not so much of advanced, but there's the advanced medicines are there. There's not a. We have to control the hypertension by.
But in general, if we talk about the technologies, like the hospitals have nowadays like upgraded, and things are becoming more upgraded. So on this, what do you have to say? Like general?
No, basically the upgradation is in the diagnostic part. So we can make diagnosis very quickly with the diagnostic tools and these things. But as I say, hypertension, the diagnosis is basically clinical. You need only one BP machine to diagnose the patients. You know the history. He's come with some symptoms, or accidentally will find something like he come with back pain. As we regularly see the pressure, we have seen there is a hypertension, there is a high BP. Increased technology, there is no as such increased technology to diagnose the hypertensive part. Yes, there is some confusion with some people, like okay, my BP is morning 160/90. Now you have seen and you said it is 130/80, but 2 days back my BP was 170, something like that. Some confusion make it when sometimes his BP became low, sometimes BP is, and then we'll do an ABP, means ambulatory BP monitoring. So we attach the machine to him 24 hours. We calculate the 24 hours BP with the patients, and if we found that yes, he have a maximum hyper pressure in the whole day, then we'll start treatment. And with the ABM machines, we'll know at what point, means if the BP is more in the morning, we'll start the BP in the morning. If the pressure is more in the evening time, we'll start the BP in the evening time. So interestingly, the person do old ages, we have seen the BP is more in the morning time, and the person who is young and the very stressful jobs, they basically have BP in the evening time.
So how long is the observation part done in the hospital, doctor?
Observation is about 24 hours.
24 hours.
For basically it depends. 24 hours we have to observe, or for urgency no need for any observations. We'll call him next 24 hours also, after 3 days also, but he have to be in the contact touch.
All right, doctor, we have a phone call, so let's take the phone call and then we'll continue. Hello.
Hello.
Apnar proshno to koribo. Hello.
Mor proshno mane mor ghorat gute high pressure patient ha. তো সবে মেডিসিন এটি দিয়া সবা তাৰপিছত নিজে নিজে টেনশন খায় প্ৰবলেম কেনেকুৱা হ'ব পাৰে ডক্টৰ যাব নোখোজে কোনো
Okay, it's a common problem in every household. So
it is a common problem. Eto sobore nijor nijor eta problem ase, etu apunar boli no mur ghorato ase. So মোৰ দেউতাই মোৰ মেডিচিনে নাখায় এইটো কি ক'ব কিন্তু কথাটো হৈছে কি প্লিজ if your family is one of the most common problem is in hypertension is one of the মানে যেটো আপোনাৰ থাকে আৰু বেসিক্যালি জেনেটিক্যাল ফ্যাক্টৰ এটা আছে আমাৰ বডিত যে মই আপোনাক কজ বিলাক কোৱা নাছিল কজ বিলাকৰ এটা কিছুমান এটা মোস্ট কমন কজ আছিল এনভায়ৰনমেন্টাল তাৰ পিছত জেনেটিক ফ্যাক্টৰ আহে জেনেটিক ফ্যাক্টৰত পৰে যে ফেমিলিয়াল আপোনাৰ যদি মা দেউতাহঁতৰ প্ৰেছাৰ আছে তেনেহলে আপোনাৰ প্ৰেছাৰ হ'ব পাৰে আৰু জেনেটিক ফ্যাক্টৰ বিলাক বেছি আমি ক্যালকুলেট কৰো আৰু এইবিলাকক এসেনশিয়াল হাইপাৰটেনশন বুলি কোৱা হয় ওকে আপোনাৰ কথাটো হৈছে কি আপোনাৰ সবৰে হাইপাৰটেনশন আছে এজ ফ্যামিলি আৰু কোনো মেডিসিন নাখায় এটো হে কাউন্সেলিং পাৰ্ট এজ ইউ সে ইট ইজ এ বেসিক্যালি এ কাউন্সেলিং পাৰ্ট মই আগতে কৈছো আপোনাক ম্যাক্সিমামে মেডিসিন খাব নিবিচাৰে সো ফাৰ্স্ট অফ অল তেওঁলোকে জানিব লাগিব যে প্ৰেছাৰটো হোৱাৰ ফলত কি হ'ব পাৰে মানে তেওঁলোকৰ কি ধৰণৰ বহুতৰে একো নহয় সাধাৰণতে ইটস এ সাইলেন্ট মই বেসিক্যালি আই সে ইটস এ ভেৰি সাইলেন্ট একো নহয় মানুহৰ লাহে লাহে গৈ থাকিব বাট সাডেনলি there may be stroke there may be renal failure there may be heart attack at any moment so then they realize oh I am hypertensive but আমি হুদু আপুনি কিয় মেডিসিন খোৱা নাছিলে then তেওঁলোকে কয় না আগতে ডক্টৰে দিছিলে কিন্তু নাখালো পাৱাৰ মাজে মাজে খাও এনেকুৱা টাইপ আপুনি কাউন্সেলিং কৰক আপোনাৰ মানুহখিনিৰ লগত যে খাব লাগিব আৰু কি হয় কেনেকে খাব পাৰে হেতু এবাৰ চাই লওক আৰু যদি কিবা কিছুমান মানুহৰ ফাইনান্সিয়েল প্ৰবলেম থাকে ডেফিনেটলি গাঁও সাইডত আমি দেখা পাওঁ দে হ্যাভ লটস অফ ফাইনান্সিয়েল প্ৰবলেমস देयर आर কিছুমান মেডিসিন আছে কম দামী হেবিলাক মেডিসিনও খাব পাৰে কিন্তু কিবা এটা মেডিসিন খাই থাকাটো মোৰ মতে দি দৰকাৰ প্ৰেছাৰৰ কাৰণে আৰু যদি গুটে ফ্যামিলিটোৰ আছে ডেফিনেটলি ৰিস্ক ফ্যাক্টৰ থাকিবই বহুত আপোনালোকৰ হেতু চাও কি হয় হয়তো খুব বেছি নিমখীয়া বস্তু খাইছে নেকি বা লাইফস্টাইল অলমানটো হেই নেকি আপোনালোকৰ খুব সেডেন্টাৰী নেকি খোৱা বোৱা এইবিলাক অলমান চেক কৰি ললে বেছি বেটাৰ হয় কিনি বেলে একো নাই আৰু
And nowadays many people think that taking lots of medicines every day regular medicines can affect their kidney as well so these things are a notion in everybody's mind so
yes.
On this like doctor what advice can you give it to the patient so you should not stop your medicines unless and until your doctors have advised you
basically we give the medicine as low as possible as Indian scenario so in American and European scenario they said that they give medicine as much as possible
okay.
but in Indian scenario will give our doctors will give as low as possible we know that our people are not taking the medicines so they will not take actually basically the medicines are costly or compliance it is called compliance is very poor that they forget to take the medicines regularly they hesitate to take the medicines regularly so I request all to take the medicines as much as possible if they can and what you asked to me
yeah about the initial stage like I was asking you what is the first medicine do you prescribe and what is the requirement and what is the mgs being provided to the initial patients
it depends basically it depends to individual it's not like that the same medicine patient will get the same medicines everybody may get different prescriptions yes sometimes it's same with the people but basically will change or there is not too much of medicines are there there are very few medicines are there in the line of anti-hypertension so basically we'll shuffle them accordingly and there are side effects are there as you said and that's why the people they think that kidney will fail liver will fail not such like that we'll do regular blood tests to see the side effects of the medicines if you find there is a side effect and we immediately stop the medicine and we switch over to the other medicines
all right
so it's not like that the only will continue if they have and that is the basic the idea that you have to follow up follow up regularly that term is very important
regular follow up is very important and also to go and see doctors
we have seen the patient coming to me today then they will go to the another doctor then go to the other doctor That happened.
So the treatments change, the procedures change,
sometimes
medicines
what happened,
change.
he has a hypertension, he come to me. After 6 months, he has something gallbladder. So he go to any hospital. They then the hospital, there other doctor, they have seen the patient. They will change the medicine. Then he had something cardiac arrest. Then he go to the other hospital. Again, that doctor will see. Then they will change the medicine. Actually, that way also sometimes the patient will keep changing the medicines. And otherwise, if there is nothing, then you go select one particular doctor and continue follow up with the same doctors, because he will know your background very well and he can change accordingly. If he referred the patients to other doctor, though I cannot now do the, I'll refer you to the other doctor, then and senior doctor, then you go and then you can consult.
All right. So there are other lots of things like one should keep in their mind, the ones who are already facing hypertension and the ones who might face, or what are the precautionary measures one can take on? Doctors, what?
That is the, as I said, it is
lifestyle is one most important.
Pre-hypertensive stage. Sometimes the BP is less than 140, but it's more than 120. So this is pre-hypertensive stage. He may fall into hypertensive stage. Please note, the viewers, that pre-hypertensive stage is equivalent having risks to hypertensive stage. It's a little small, but you are equally fall in the same risk factor. So if you are pre-hypertensive state, your BP is less than in the higher side, like more than 130.
Okay.
Takes these precautions. As I said, first, lifestyle modification. What is lifestyle modification? First of all, I said reduce your weight. BMI should be 25. Reduce salt. Reduce your junk food and everything. Regular physical exercise.
All right. So these are some of the basic things one can adapt in their lifestyle, and they can also change their lifestyle by adapting these things. Regular exercise and lifestyle modification is very important, and junk food has to be straight no. And there are some other precautionary measures doctors one can take up, and taking medicines is not a big deal, isn't it?
Only precautions is in hypertension is you have to take medicines or you have to change your lifestyle. Apart from this, there will nothing. You will do puja, you will do everything, there will be nothing.
We have also seen that this is, as it's been related to genetic as well. So on that part, what you will say?
As I say, genetic. If your mother and father both are hypertensive, or one is hypertensive, then you may be a hypertensive patient. So it is called familial hypertension. So if it's a familial hypertension, then you have to take medicines. Otherwise, that familial hypertension, the chance of having or target organ damage is higher than the other part.
All right, doctor, there were some questions also which came in our email, and I would like to put forward to you that there are some diabetic patients, so they think that it is also a risk factor for hypertension. So how is it related if a person is having diabetes?
Yes, if diabetes is along with the hypertension, the chance of they are double sword blade, it's like double sword blade. So both the risk factors will can cause renal failure and heart failure. First of all, so if the patient is diabetes with hypertension, the having of heart attack, chance of having of heart attack is twice that of the normal person.
Okay.
So or only hypertension. So if the patient is having hypertension with diabetes, then I ask him to twice your follow up with the doctors than any non-hypertensive or non-diabetic patients, and take regular medicines as prescribed by your doctors or your other measures.
All right, so what kind of heart problems a diabetic patient will have, doctor?
Yes, diabetic patients basically have lots of heart problem. Diabetic cardiomyopathy is there, it's second, and first is the heart attack. So what happened in diabetes, the sugar level in the blood is increases. So that sugar actually not used in the blood, so unused sugars, so they remain in the body. So that's unused sugar, to carry this sugar, the heart have to work fast and better, more, and the cardiac output actually increases. Then they, what the sugar do, they erode the border of our arteries. The artery which are in the heart, if they eroses, the cholesterol will deposited there.
Okay.
Okay, so one time will come, lots of cholesterol deposited, they block the artery, suddenly there is a bursting and the platelets and bleeding will occur, and to stop the bleeding, the platelet will come,
Okay.
and whole artery will be blocked. So that condition is called heart attack.
Heart attack.
So primary, what is the primary? There is a increased blood sugar level in the blood, erodes the endothelium of our arteries, basically in the coronary artery of the heart. There is a cholesterol depositions, there is a bleeding, and there is a heart block.
Okay.
So that is the relation of diabetes with the heart.
So in general, a diabetic patient will have to be more careful, and diabetes with hypertension, another more careful, isn't it?
Yes, sir.
All right. So doctor, like we are short of time, so there are lots of things to be covered up in this topic, but what would be the things and what would be the final tips you would like to give to the viewers to take care of, and also to the parents and also to the attendants and also to the younger generation who move out and make their career and they take a lot of stress and have a lack of sleep. So what are the things and what are the minute things you would like to tell them?
So viewers, as I said, hypertension is a silent killer. So first of all, please, if you are a hypertensive patient, to check your hypertension regularly, take blood pressure tablets regularly, regular follow-up with your local doctors, and do not forget to do necessary investigation if they prescribe. And lifestyle modification is one of the major tool from your part, actually, not from the doctor part. Doctor always advise to change your hypertension to non-hypertensive stage. You become non-hypertensive, your organ will be okay, and you will lead a normal life. Thank you.
All right, and doctor, I would also like to ask you, there are lots of equipments we can keep at home to have a check of hypertension and also to check our blood sugar. So are those kits and all available and also can be kept at home? So what is the procedure, if you would just like to advise?
We can. There are lots of digital meters are there in our home. You can, if you know, blood pressure measurement is not so difficult. You can go any clinic or doctor. They will show you how to measure the blood. Or you can take the digital meters also. So digital, you can apply digital meters, and digital meter will immediately automatically tell you the what is blood pressures. So they are not so reliable sometimes, but they give you a clue. If you get some absorb or abstract numbers like it's hypertensive or it's too high, you can consult your doctor immediately. Then I am hypertensive. So, and if you are a hypertensive patient or you carry a digital meter with at home, you can measure your, it's okay, fine, it's not a problem. It's
and also the blood sugars also can be
blood
checked.
sugar also you can check with the glucometer. Digital glucometers are there, and there people are using now.
All right. Thank you so much, Dr. Debanga Borah, for coming to our studio, and we had a fruitful discussion on hypertension, and we hope that with this we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. But in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Sunday at 5 p.m. live. So till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.